Okay, so the CDC has been busy and they have been changing a lot of the recommendations. There's been a lot of new news with Omicron coming out. We are going to go through some of the breakdown of where we're at as of today, which is December 29th. Let's get to it. First of all, the definitions are going to require a couple things that we all understand the same terms. There is isolation and there is quarantine. It's easy to get those confused. Isolation is you have COVID. It's been confirmed. You got COVID. You need to isolate and stay away from people. Quarantine is you've been around COVID. There's a suspicion you might get it. You might be in the middle of brewing an infection. Quarantine is might get COVID or have been around COVID. Isolation is have COVID. So, what are the new definitions? For a long time, we've been dealing with 10 days of quarantine if you haven't been sick enough to go to the hospital, or 10 days of isolation. And then if your symptoms were gone, you got to go back about your life. That has been how most of us have been living for a while now. Now the new recommendations from the CDC have been a little bit different. Now they've dropped it to 5. 5 days of don't be around people, and then 5 days of wear a mask when you're around people. That is going to be a big shift, and we'll talk a little bit about some of my suspicions of where that might have come from, but that is the new thing. Also new on the quarantine front, the don't know you have COVID but might have COVID. The CDC is now saying you're going to want to go ahead and stay away from everyone for 5 days and then wear a mask. But if you can't stay away from everyone, if that's not feasible for whatever reason, just make sure you wear your mask if you were exposed to COVID. The issue there is, what does feasible mean? Does feasible mean if it's annoying? Does feasible mean if you'll lose your business? Does feasible mean if someone's going to put a gun to your head? Who knows? Because that is a very subjective and open, vague statement, and it's got a lot of people questioning what to do. And then the thing that is interesting to me as a healthcare worker is a few days prior to that, and I'll link these below. It was on the 23rd, I think it was. Rules came out changing all of this for healthcare workers. And we went to the 5-day criteria a little bit earlier than everybody else did, at which point I thought that was a little crazy, because why would healthcare workers need less isolation or quarantining than everybody else? It felt like more of a, I'm going to admit it, it felt like more of a supply and demand issue to me than it did to the science of who was at risk and what the medical data was saying there. I think it really came down to the fact that we have to have somebody in the hospitals, and there was a change in policy there because we've been a little short-staffed. So now, I'll link you again to this picture below. There are new guidances that if healthcare staffing gets real low, we just start changing that altogether, and even people who are known COVID positive can immediately go back to work if staffing levels reach crisis. That to me is concerning for a couple of things. One, our hospital workers or healthcare workers can't even catch a break if they get COVID. If they're short, staffing is short, they're just supposed to put on a mask, tough it out, and get back to work. I'm not a big fan of that, from the risk of infecting other people. And it seems problematic to me. So there's a lot of stuff to digest. Let's get through some of the reasons why this might be happening. So let's go through 4 possible contributors. I am not part of the CDC committees. This is all conjecture on my part as to why they might be changing some of these rules. First is there was reference on the CDC page data that shows transmission is highest in the first few days. I haven't seen that. That probably exists if they're saying it does. I haven't seen it yet. If someone can find that for me, post it, and I'll be glad to take a look through it. It does make sense to me that if someone is highly symptomatic, that they might be more actually transmitting of the virus. But I don't know. I haven't particularly seen that. To me, I think that if they found that data, then that'd be wonderful, and that's good. I think another possible reason could be as Omicron becomes one of the more prolific virus strains, and if Omicron continues to show to be less dangerous, then maybe there is less reason to try and isolate everyone from each other and quarantine everybody from each other. I think there are some question marks, asterisks that we need to put there. One, I think Omicron is too new to know for sure 100% if it will be continued to be less symptomatic and cause less dangerous problems for people. I'm not sure we 100% know that yet. 2, I also think it's so new that we certainly know it's very, very contagious, but I don't know that we have great data on how many days into an infection it is contagious. I think we're a little too new to know that. So I think maybe the predictions about Omicron may have some play in the changing of the isolation and quarantine guidelines. I think another one is potentially the fact that, at least here in America, because the CDC is an American entity, at least here in America, I think that it is fair to admit that whether you love the idea of isolation and quarantines or you hate them, that people are getting tired of them. And I do think that it is possible that the CDC takes some of that into an account and is potentially, and this is again conjecture here, potentially trying to get some sort of compliance and saying, well, you know what, if we ask for 5 days, at least maybe people will do that, as opposed to asking for 10 and just acknowledging that maybe the amount of people ignoring that will be higher if they try and ask for 10. I do think that fatigue on the part of the populace is probably a thing. You see YouTube videos all the time of people fighting wearing masks and people protesting about vaccine mandates and things of that sort. And I think that there is a certain amount of fatigue on the part of the American populace. And I think that brings into our potential reason number 4 for this, which is that the CDC is a government entity, and part of being a government entity is trying to do whatever you think is appropriate, for better or worse, however you happen to agree politically, that you have to keep things moving. And at a certain point, people will want to go to work and or need to go to work. Services need to be happening. And I think that is somewhat reflected in the fact that the CDC guidelines now say, if we're at crisis levels, even the COVID positive doctors just got to get to work. The COVID positive nurses, put on your mask and just go see patients. If we're at crisis levels of staffing, because the patients have to be seen, and it doesn't matter if you have COVID, you got to go see them. And I think that to varying degrees, that could be influencing some of these guidelines, because there are a lot of fields that are important. Obviously, I'm a doctor. I think doctors are important. But quite frankly, try and live your life without plumbers, right? That is going to be very, very difficult, because you need plumbers. Try and live your life at a hospital without all of the cleaning staff and the environmental folks. Try and live without the maintenance folks who keep all of the pumps working. You can't do it without a lot of people. Society is very integrated and very dependent on each other. And there are a lot of things that can't happen if a lot of people don't go to work. And I think it is possible that with a very, very contagious strain of COVID coming around, particularly one that is initially believed to maybe be less dangerous, maybe, who knows, we'll see, that they just said, hey man, everyone's going to get this, so at some point we're going to have to go to work. That is a possibility. I don't know. I think that, again, the only thing you can do about this, I don't think living in fear is necessarily useful or productive. I think you should do the things that you can. I think so far, appropriate weight control seems to be a thing that improves survivability across most of the COVID strains. Vaccination, I still believe, is very, very good for most people. And if you haven't been vaccinated at all, you are probably a candidate for it. Check with your doctor and see about getting that done. Try your best to be nice, to be patient with each other. We're all trying to get through this. Admittedly, I am a little confused by some of the CDC directions here, but I don't have access to all the data they do. Maybe they're all just smarter than me and I haven't figured it out yet. Hope you guys have a good day. Try and be safe out there, y'all.